Hi, my name is Dr. Roland Nemirovsky of Living Well Medical. We specialize in chiropractic, physical therapy, and pain management. Today we're going to have a patient who complains of wrist pain. She has a chronic condition, and we're going to utilize the Graston Technique. For the wrist, we did a number of treatment therapies. We utilized chiropractic manipulation to the joints. We used Graston Technique to help break up some of the tissues. We used electric stim with heat to warm them up before we do the Graston. We also use something called kinesio tape. Kinesio tape is great in that it helps with function, restoration of normal activity within the tissues themselves, lymphatic drainage, which is great. Combination therapy for any type of tissue malfunction. Electric stim, it helps with conditioning the muscle. Typically what you want to do is get the muscle to fatigue. Fatiguing the muscle, it relaxes, and therefore you're going to relieve some of the stressors, specifically if the muscle is in spasm. So here I'm using Graston Tool 6. This tool is specifically used for smaller areas, specifically around the hand. You could use it for conditions like carpal tunnel. It's really great because it could work the muscles in and around the hand in this direction. This side is really great because you can get in between tendons, and you can get nice and deep inside between the wrist bones that exist right over here. So it's a really great tool if you're going to work small areas. So typically what happens is people will do things repetitively, incorrectly, and that causes overuse injuries. These overuse injuries can cause tissue quality to change. So you lose elasticity, they can adhese. When scarring occurs, tissue quality has changed. You have reduced range of motion, and with reduced range of motion comes dysfunction, and therefore you eventually get pain. As you can see, you have some inflammation building up, which is a good thing. Graston's great in the fact that it causes inflammation. In this case, inflammation is a good thing because you want to bring fresh blood and oxygen to the area to help clean out all the toxins that have built up and help heal the tissue faster.
It's a good pain. It hurts a little bit, but I think it's helping, so hopefully it'll be worth it.
It's helped in the past.
It's helped in the past too.
Some of the responses you get are inflammatory changes. Specifically, you get petechiae right there. When that comes to the surface, those tend to be more of the trouble areas, and it's normal to see that when you're doing Graston. When the tissue is really bad, you'll see that the entire tissue will be covered and gets really red and inflamed in that region, which for Graston's sake is a good thing because that means we're working the right tissue, and the inflammatory response will actually cause healing to occur at a much faster rate. Cold laser therapy is a great adjunct therapy as far as being helping tissue heal faster and quicker, more efficiently, so that you get better function and restoration of normal function. As far as her cervical complaint or her neck complaint, she was getting a lot of tightness right here in the muscles located in the base of the skull. We treated those muscles, we adjusted her, and she pretty much is headache free over the past 3 days. She felt better within 2 treatments.